Hi everyone, and thank you for watching our latest video. So this is on a topic on which I get emergency calls several times in a year on what are we supposed to do. So what is one supposed to do when there is a burn? So these situations happen when your child may have burned their hand on a firecracker, or you're working in the kitchen and hot oil splashes on your face. So there may be some time before you are able to reach a doctor's office or get an appointment, and what are you supposed to do till then? Different people have heard different things. Some people have heard that you're not supposed to soak in water, you're supposed to wrap a blanket around the area. Some other people have heard, no, you're not supposed to keep it warm, you're supposed to put it in water. So what is right? And the fact is, how you treat your burn in the first few hours, especially the first 24 hours, is going to be very important in how the burn will eventually heal and whether you'll be left with a scar or not. So here's what you will do. Yes, you're supposed to soak the area in water. Clean drinking water, preferable to running tap water. If it's on the face, splash a lot of water on your face over and over for several minutes. The next thing that you will do, you can apply ice on it as well, but don't apply ice cubes directly on the wound. You're supposed to wrap it in a hanky, pat and release, so it will soothe that area. What can you apply on it that will be available easily at home? So antiseptic ointment. Every household should have a tube of antiseptic ointment for these kind of emergencies, whether it's a cut or a wound or an injury or a burn. So ointment like a Fusidin ointment or a tea-bagged ointment, apply that immediately. A lot of people have heard of Silverex ointment. Definitely it works better than a Bernol or Borolene or a Boroplus. But a lot of dermatologists are not prescribing Silverex a lot nowadays because the silver in it actually pigments the skin a lot. And Indian skin as it is pigments very badly after a wound or an injury. So tea-bagged ointment works very well. What if you don't have that? A lot of people have heard that you should apply raw egg whites. Please don't do that. Raw egg whites have a lot of bacteria in it and it can get infected. I've seen people putting band-aid on a burn. Don't do that either because a burn is eventually going to blister. So when you remove the adhesive band-aid, the blister is going to peel off as well and it's going to be very painful. I've seen people doing other things like putting cotton wool on it. So if you put fluffy cotton in it, the cotton fibers will also stick to the blister and the oozing, and that makes it more difficult for us to clean and dress the area. If nothing else is available, every Indian household has turmeric. So turmeric is also very good. It has antiseptic properties in it. If it is already blistered and it's open and it's oozing, then probably turmeric is not a good idea because then the oozing and the turmeric, it cakes up and it becomes a little difficult to clean and dress the area after that. Or if you feel the turmeric itself is a little adulterated now with other spices, it's not clean anymore, then most Indian households will have petroleum jelly. So petroleum jelly is also something that you can apply in that area till you get time to meet a doctor. Of course, you should immediately start picking up the phone and try making an appointment with your dermatologist. For superficial burns, dermatologists are good enough. If it's an extensive burn, you've really poured hot water, large areas of your thighs or your stomach is badly burnt, then a dermatologist is not the right person to go. Please immediately go to the nearest hospital, to the emergency room where a dermatologist and a plastic surgeon will be able to attend to you. If it's a bad burn, no matter how good your care is, please be realistic, it is going to leave marks and scars. But as soon as the wound is healed, if you immediately start working on the scars, then yes, in the next 3 to 6 months, the scars can be faded off to the bare minimum.